Well, my friends, this is a case of ankylosing spondylitis. Ankylosing spondylitis. So, ankylosing spondylitis, I have seen many cases, but this is a very worst type of case. The man is totally stooped. I do not like to show his face, but at a glance from outside, you will observe the serious bending position of the man, totally stooped forwards, which is known as kyphosis, a total kyphosis. It is very difficult to erect the posture, and because the vertebral column is totally bended over. So this is a serious case of ankylosing spondylitis. The man cannot stand even in erect position, cannot sit in erect position, cannot move in erect position, cannot throw his body in erect position. Serious case of spondylitis. I have repeatedly told in my older videos, previous videos, what is spondylitis. Spondylitis, it is nothing but a kind of arthropathy, arthrology, arthritis. It is a arthritis where the ossification of the prevertebral ligaments, especially the sacroiliac joint and vertebral joints, become fused. The sacroiliac joint, this is the hip bone. How many parts of the hip bones?
4.
3 parts. Iliac, ilium, pubis, and ischium. The medial side is known as pubis. It is known as ischium, and this is known as ilium. This is known as the iliac crest. And the ilium bone, when joins with the sacrum, the joint is known as sacroiliac joint. Sacroiliac joint. And the vertebral column, when one after joins by intervertebral disc and some ligaments, this total vertebra as a whole known as spine. It is known as spine. So in medical term, in anatomy, in physiology, in surgery, in pathology, rightly beginning from the occiput up to the sacrum, the whole vertebral column is known as a spine. And this process is known as the spinous process. The triangular end of every bone is known as the spine and totally known as the spinous process. So the intervertebral joints are fused. এগুলো গায়ে গায়ে লেগে যায়, কার্টিলেজ ক্ষয়ে যায়, গায়ে গায়ে লেগে যায়, তাহলে লেগে গেলে কী হচ্ছে, ওইগুলো তো মুভমেন্ট করায়, এরাই মুভমেন্ট করায়, সো মুভমেন্ট বিকামস রেস্ট্রিক্টেড। তাহলে স্পন্ডালাইটিস আমরা যখন দেখি এরকম হয়েছে পার্টিকুলার পার্টে শুধু সার্ভাইকাল ভার্টিব্রাল রিজিয়নে যদি হয়ে থাকে তাহলে আমরা বলি সার্ভাইকাল স্পন্ডালাইটিস। অনলি সার্ভাইকাল ভার্টিব্রালের মধ্যে যদি লিমিটেড হয়ে থাকে সার্ভাইকাল স্পন্ডাইলাইটিস। শুধু লাম্বার ভার্টিব্রালের মধ্যে যদি হয়ে থাকে ওইরকম ফিউজড হয়ে যায়, আর্টিকুলার কার্টিলেজগুলো ক্ষয়ে যায়, তাহলে লাম্বার স্পন্ডাইলাইটিস। থোরাসিক স্পন্ডাইলাইটিস হয় না, হয় ঘাড়ে, cervical and lumbar. But what is the difference between the normal spondylitis and this ankylosing spondylitis? Ankylosing spondylitis fuses the joints of the sacrum and iliac. Sacroiliac joint or iliosacral joint become fused and all the intervertebral joints become fused. So it is a very serious condition, a very serious disease, a very serious degenerative disease. So a tendency of ossification of the paravertebral ligaments of the sacroiliac and vertebral joints. The disease is more common in males. Rheumatoid arthritis is more common in females, but ankylosing spondylitis is more common in males, especially in young males. The etiology is obscure. সঠিক কারণ এখনও জানা যায় না। মনে করা যেতে পারে the cause is immunological, immune deficiency. So the etiology is obscure, although some of the pathological features it shows that one of the antigens of the blood is increases. The name of the antigen is HLA B27, humanoleukocytic antigen. But it is not rose water test, it is not latex fixation test like rheumatoid arthritis. Only HLA B27 test is the final choice of mode to determine the disease. Now, what is the pathology behind it? The pathological changes are first observed, I have already told, in the sacroiliac joints and the intervertebral, especially the posterior intervertebral joints. In the intervertebral joint, there are anterior longitudinal ligament and in the backside posterior longitudinal ligaments. The posterior longitudinal ligaments are destroyed, and the costovertebral, manubriosternal, all joints become fused, result of which the man becomes totally paralyzed, totally handicapped, totally immobilized due to ossifications of the vertebral joints, due to ossification of the paravertebral ligaments, that is the lateral longitudinal ligaments, the posterior longitudinal ligaments. The spine becomes rigid. So the spine becomes rigid, the intervertebral discs are almost invariably spread, the hips and shoulder joints are the next affecting parts. এরপরেই হিপ জয়েন্ট এবং শোল্ডার জয়েন্টগুলো এফেক্ট করে। এরপরে তার ফার্স্ট ইজ sacroiliac joint and intervertebral joints. In addition to that, the man also suffers from arthritis of the hip joint and shoulder joint, the fibrocapsular joints. The cardinal features are pain, rigidity and deformity. The cardinal symptoms are pain, rigidity and deformity. In rheumatoid arthritis, there is also deformity, but this deformity is much more dangerous, much more serious and much more vulnerable than rheumatoid arthritis. It is more vulnerable. So, kyphotic changes, সামনের দিকে ঝুঁকে পড়ে। Kyphotic changes, the man becomes kyphosis. You know there are three types of bends. When the anterior bend, which is known as kyphosis, posterior bends lordosis, and side is scoliosis. In this disease, the man becomes stooped forwards, and it is known as kyphosis. So the patient walks like an old man with stooping shoulder, stooping posture, with head bending forwards. This disease slowly progressive by years, আস্তে আস্তে বাড়তে থাকে, কিন্তু not so notorious, the patient will die. মানুষ মারা যাবে না, কষ্ট পাবে। The disease slowly progressive for years. The disease is not fatal for a distressing on rheumatoid arthritis মতন মানুষকে শুয়ে দেবে না, পুরো প্যারালাইজড করে দেবে না, পুরো ক্রিপেল করে দেবে না, চলাফেরা করতে পারবে, কাজকর্ম করতে পারবে, বাট পেইন, রিজিডিটি অ্যান্ড স্টিফনেস আর দ্য চিফ কমপ্লেন্টস, মাই ফ্রেন্ডস। সো নেভার ফরগেট দ্য rheumatoid arthritis and ankylosing spondylitis. Those are separate diseases, but the symptoms are different, their examination are different. In rheumatoid arthritis, always the ESR becomes high. In ankylosing spondylitis, ESR may not be high. Now, both are autoimmune disease, but the intervertebral discs are first replaced in ankylosing spondylitis, and in rheumatoid arthritis, only the finger joints or small joints or the joints of the extremities first affected. So main difference, ankylosing spondylitis এ sacroiliac joint, intervertebral joint আগে অ্যাটাক করবে, এই রিউমেটয়েড আর্থ্রাইটিসে হাতের ছোটো ছোটো জয়েন্ট, ঘাড়ের জয়েন্ট এগুলো আগে অ্যাটাক করবে। রিউমেটয়েড আর্থ্রাইটিস পেশেন্টকে শুয়ে দিতে পারে, কাজকর্ম স্তব্ধ করে দিতে পারে। অ্যাঙ্কাইলোজিং ততটা ক্ষতিগ্রস্ত হয় না, সকালে ঘুম থেকে ওঠার পরে স্টিফনেস এইসব ভাবগুলো থাকে, আস্তে আস্তে চলাফেরা করতে পারে, শুধু স্টুপিং ফরওয়ার্ড, সামনের দিকে মানুষটা ঝুঁকে যায়, সমস্ত অর্গানগুলোকে, এক্সট্রিমিটিসগুলোকে ক্রুক করে না রিউমেটয়েড আর্থ্রাইটিস মতো। অ্যান্ড দিস ডিজিজ অনসেট ইজ ইনসিডিয়াস, especially aggravates during getting up. Now about the homeopathic treatment. In homeopathic treatment, like all diseases, our main motto is the symptomatology. This gentleman requires staphysagria to me because all the symptoms of rheumatism is not a matter, not an important matter to me. I have observed, I have learned from the patient, he had great mortification since his childhood. Due to family affairs, due to personal affairs, all along his life, he had great mortifications and indignation from his childhood. Indignation to his relatives. So I think this is one of the cause of his ailments, not for this disease, throughout the any disease, for any purpose. It is one of the cause of disturbance of his illness or health hazards, mortification or indignation. So I do like to prescribe staphysagria, and staphysagria 1 m 2 doses followed by PTRS is given. Let's see the result. I shall share with my friends. Along with this medication, physiotherapy is very, very essential for such kind of patients.